Turning to the Capitol, where lawmakers are now one step closer to voting on the bill that would help fund the Hennepin County Medical Center. The hospital could close if it doesn't receive state help. Jennifer Hoff is here with where things stand right now. Jennifer?
Kevin, the bill passed its last committee hurdle today and is now expected to hit the full Senate floor next week when lawmakers would vote on whether to give $50 million to HCMC this year and $100 million next year. There's also one other proposal still on the table, but some argue even all of that may not be enough.
Government will come to order.
From lawmakers at the Capitol in St. Paul.
This is a complicated topic.
To commissioners in Minneapolis.
It's healthcare. It's employment.
A heart-tugging tale of two meetings with one goal.
So we got to save this one.
Trying to save the Hennepin County Medical Center isn't easy. The Level 1 trauma hospital serves people all across the upper Midwest, funded mostly by Medicaid. Now facing so many federal cuts, hospital reimbursement rates are going down as uncompensated care goes up.
We have no power over that reimbursement, but we are subject to all the effects of it.
The hospital board chair does support another bill to raise a county sales tax by 1%. Lawmakers, though, already proposing to slash it at least in half.
I do have people who tell me we need to say hospital, but I also have taxpayers wondering why the heck are we providing so much care to people who don't live in Hennepin? And I think it's a fair question.
The board also considering how to best run the hospital, including scrapping elected officials for medical professionals.
I think we should pay the board, and I think we should make sure we have expertise.
There are fewer than 20 hospitals like HCMC all across the country, considered a safety net for so many. Its future tied to a legislative session that ends in less than a month.
Healthcare shouldn't be a partisan issue, and we should be able to make sure that there's enough safeguards to make sure that it's, our healthcare delivery of the most vulnerable is protected across that.
And this isn't just an HCMC problem. It's affecting hospitals all across the country and our state, especially the rural ones. And there aren't any hospitals nearby that could absorb all of HCMC's patients if that hospital were in fact to close.
You know, Jennifer, do we know, is this proposed funding bill, is this a long-term solution or just a short Band-Aid fix?
That's what a lot of the leadership at HCMC is hoping for, that the sales tax will in fact provide a much longer-term solution, and that's exactly what they need in order to offset all of these cuts that will take place, especially over the next decade.
All right, Jennifer, thank you.